The paper then published 109 implants in 97 patients, and you see average age 63, and you see here the ISQ values at day of surgery. This is here, and you see the mean value was 67, the median value was about 73, but you see a lot of outliers here, including the case with 30. And here then 8 weeks later, the mean value went up to 73. The median is 74. And you see, of course, the standard deviation is much smaller, but we still have a few outliers. The threshold would be 70. Okay, that's what we measured. Here you see now all these 109 measurements, and you see that, of course, the curve most often goes up, but not in all of them. So when we measured now at 8 weeks, you see we figured out that 83% of all implants showed an ISQ of 70 plus. So these 83% got a green light to go into restoration. Now the loading, of course, does not start 8 weeks because most of the patients are referred back into private office, and then goes another 1 or 2 weeks before then the implants are restored. Here you see now when we take them apart, the left graph shows all the values going up above 70. These here are values where actually the number goes down, but of course these are very high values, 85, a lot of primary stability, probably cortical bone, goes down, still 80 or 79. And these are the 17% of implants that actually did not reach 70 at 8 weeks of healing. And you see now 8 weeks, 10 weeks, 12 weeks, 16 weeks. You see how the ISQ values go up. So that shows the potential of this technology.